Hello, and thank you for joining our webinar, Telehealth Services Available During the COVID-19 Outbreak. I'm Seth Lunan, Chief Revenue Officer, the MTBC Telehealth Division. I wanted to welcome everybody to our webinar and just handle a couple of housekeeping items. If you have a question during the webinar, on your panel, on your screen, there's a question panel. You can enter your questions there in text. Everyone is on mute during the presentation. We will attempt to answer questions afterwards if we can fit it in. Otherwise, the questions will be addressed individually after the fact. If anyone cannot see or hear properly, this recording will be available online and made available to you through a link. I want to introduce our presenter today, Suzanne Casimore, the MTBC Coding Director. Suzanne?
Thank you, Seth. And thank you everyone for joining us this afternoon. As I'm sure everyone is of the understanding that Medicare has made some changes allowing telehealth services to be available to patients during this COVID-19 emergency situation. And I wanted to sort of go through the coding and what's available to the providers during this situation here with the COVID-19. So what Medicare and CMS and the president has done is opened up telehealth services across the country for all of the Medicare beneficiaries starting on March 6th. And that will go for the duration of the COVID-19 public health emergency, as we're not certain when that emergency will end. So it is an open-ended duration. Now, in the past, Medicare does pay for telehealth services, and there are requirements for that, such as the originating site needs to be either a physician's office or a hospital or a skilled nursing facility, but they've released all those restrictions. So now patients can receive services, telehealth, in their homes. And that's to obviously keep patients seen that need to be seen for any COVID-19 issues or just regular health concerns that they need to be followed up for on a regular basis during the emergency time. Now, this waiver from CMS, there is a caveat here that it requires that the patient have a prior established relationship with the practitioner or the practice. Now, during this time, the HHS has said that they are not going to audit that relationship does exist during any of these submissions during this emergency time, but that is one of the requirements. So as far as new patients go for these providers, if the telehealth services are provided based on the originating sites that were originally approved by Medicare, such as the physician's office, skilled nursing facilities, or hospitals, then the new patient visits would apply and would be permitted. Now, there's three main types of virtual services that are available. Again, the telehealth visits, which are your basic E&M codes, virtual check-in, and e-visits. So I'm going to go through each one and sort of explain them to you. First, the telehealth visits. Now, telehealth visits is that the provider must use an interactive audio and video telecommunication system. Now, there was HIPAA guidelines and regulations in prior to the COVID-19 emergency where they had to use certain systems for privacy. They have lifted that requirement and they're allowing Apple FaceTime, Skype, or any other similar types of apps. They're approving those for telehealth. As long as there's interactive audio and video, Telecommunications, it is considered a telehealth visit. The providers that are allowed to provide telehealth services are listed here as well. It's your physicians and your mid-levels. There are, certain providers that are not, and they also have other options for them as well. Again, this is requiring that patients have a prior established relationship with the practice. And as far as reimbursements go, Medicare is reimbursing the same as if the patients were seen in person. So if it's a 99213, whatever you were getting when the patient came to the office, you're going to receive that same amount, the allowed amount, perform telehealth in their homes, excuse me. Medicare is also allowing all healthcare providers to reduce or waive the cost sharing for telehealth visits. That is left up to you and to all telehealth providers, whether they want to waive those cost sharing for these telehealth visits. Now, here are the common services, telehealth codes. Again, your office visits, subsequent hospital care, nursing facility, psychiatric. There is a complete list of the codes, the telehealth codes. There's a link here for you. But again, this is the common codes that were approved prior to the waiver, and the waiver lifts all locations and areas. So anywhere that you're seeing these patients or these patients are being seen or telehealth services provided is on the table for reimbursement from Medicare. Now, our virtual check-ins, these codes are basically what Medicare will allow for phone calls. These are your best ones for, when you have a telephone, because there are some patients that do not have smartphones and they do not have access to computers, and they cannot do a visual face-to-face, audio-visual FaceTime. So they have these virtual check-in codes. They're G codes for Medicare. You can use telephone, email, secure text messaging, but these will typically, again, be used for phone content. These codes are used if after 7 days. So if a patient was seen in the office, a week ago, 2 weeks ago, these codes are fine to use because the 7 days have elapsed. And then as long as they don't have to be admitted or sent and seen for a face-to-face visit or another type of visit in any facility by you, then they would not, in a 24-hour period, then you would not be able to utilize these codes. But a lot of, like I said, most of these codes will be used for your patients that do not have the audio-visual communication with your patients. So that's the G2012. And there is also G2010, which is evaluation of recorded video or images submitted. So this is like a store and forward. So if the patient sends you some information, a short video, something that you need to retrieve pictures and then review and then, speak to them of or make comments on. So you would use this code, G2010. Okay, our next set of codes are e-visit codes. Now these codes have a 7-day time period. So these codes are mostly going to be when patients are sending, requests through the online patient portal that you have, sending you an email. You're not going to be communicating with them real time back and forth. It's going to be an email sent, you get to it at the end of the night, or they're asking, things of that nature. So these are time-based codes, but they're used during 7 days. It's a 7-day period for these codes. They're 99421 through 99423. So if you have any of those situations, you can utilize these online digital E&M service codes. And there's also for qualified NPPs. So if you have providers that are not, they're just NPPs G2061 through G2063, they can utilize these codes. I understand these codes, these G codes are also able to be utilized for physical therapists as well. Now, there's a big question about modifiers, especially with Medicare and telehealth. Now, the place of service for these telehealth services is O2. So the place of service that you would utilize would be O2, and that is telehealth. And Medicare only requires that place of service O2, except for these three situations here. There's information in the Medicare guidelines that indicate that a CR modifier for physicians or a DR modifier for facilities is necessary under formal waivers. But CMS had made it clear that these modifiers are not required under this particular waiver. So you don't need to add those modifiers, CR or DR, they will be reimbursed as long as you have the O2 as the telehealth services, so that they know that they will provide telehealth. There is some cases where if telehealth is furnished for a federal demonstration project or under a CAH method 2 location or any diagnosis and treatment of an acute stroke. And the modifiers are here for you if any of your visits do fall under these areas here. Okay, now documentation requirements. So what is required to document for these telehealth services? So you would need to document the services that you provided as if, again, I'm going to just use an office visit as our common ground here. So a patient, a 99213 office visit, you need to do your history piece and your medical decision making. And when it comes to physical exam, as we all know, you only need to meet or exceed on two out of the three levels. So the physical exam can be what you're able to see. They're alert and oriented, their skin is fine. So whatever is clinically appropriate that you're able to assess on the phone, that is a difficult situation for physical exams, but again, it's not required to reach your levels here for established patients. So document your services provided. The additional documentation that they're requesting is all of your patients need to give consent to have this telemedicine service. So it doesn't have to be recorded, it doesn't have to be notarized, it just has to be a conversation between you and the patient that we discussed it and they're consenting to having this visit via telehealth. Now there is some question about, most of these services are supposed to be requested from the patient originally. And in this situation, in this emergency situation, the patients aren't going to know that. And, they may be calling, some of them may be calling, some of them that really need to may not be calling to make sure that their visits, go on as scheduled. So it's okay to let the patients know that this is available to them, so that you can do telehealth services, you can do services over the phone while they're at home quarantined or just staying safe. And as long as you document that you had that discussion, that original discussion, and they agree to the telehealth, then that's what you need, as your primary documentation. Then a statement of, how you provided the services. So what telemedicine service did you utilize? You don't have to give the name, but, was it asynchronous video and audio? Was it via telephone? Was it via smartphone? Just so that, it's clear, how you did provide the telemedicine service. The location of where the patient was, the location of where the provider was should be documented, and have the names of all the persons that participated in the visit and their roles documented within the encounter. So these are just some of the additional things that you should have documented for Medicare. Okay, now that's Medicare. Medicare is pretty straightforward, and again, they've had a lot of telehealth already set up in the past. So a lot of the guidelines are just, it's a lot, they're much more lenient in allowing, more of these services to happen right now and during the emergency. Now, commercial carriers and Medicaid are a little different in so much as they will vary from state to state. Especially Medicaid. And from what I'm seeing and from my research, most, if not all states, insurance carriers, Medicaid programs are allowing telehealth services. Some are following Medicare and still having those types of restrictions in what method of telemedicine you use as to, whether or not you can consider that a telemedicine. And there are some states and some carriers that, a telephone visit, they would consider that telehealth. So we really have to do research with your state to find out, where your state is and what, your governor has declared, and how the Medicaid is going to go forward, and if any modifiers are required for them. I have some information about Aetna, United Healthcare, and Blue Cross, some of the big carriers. Again, they're opening it up, but some may not do it with unless the patient has telehealth services on their policies. So you really would need to, kind of check out your insurances for each one. There's also a wonderful resource. It's the Center for Connected Health Policy, and I have the website here. This gives updates on commercial carriers, Medicaids by state, CMS, gives you a lot of good information. It's a wonderful resource to get some more information on, more of your commercial carriers and how the payers are reacting. Here's a sample of questions, that you want to find out. A lot of this information is online with your payers. Ask the payers, what codes are you covering and what restrictions on technology do you have? Are there modifiers needed? And documentation requirements, frequency limitations, which providers are eligible. So these are some, basic questions that you can get that'll help, determine whether you can see the patients or not. Now, again, for commercial payers, basically the CPT codes, as long as there's no restrictions by the carriers, you have to confirm the restrictions and guidelines for each of those carriers. We're talking about new patients. Again, I want to kind of touch on that a little bit, because the new patients for Medicare, as long as the originating site, let's say they're in a hospital, they're in a skilled nursing facility, and you do a telehealth, it's okay to bill those new patient visits. Commercial carriers, they do not need to follow those guidelines that CMS put out for the less restricted telehealth services for new patients. So you may very well be able to bill new patients for all of the commercial carriers. Again, each carrier is going to have different requirements and restrictions on that. So you'd have to kind of look into that. And then for the commercial payers, for the telephone, I saw a lot of them are opening up and reimbursing for these codes during this emergency time. So you have the codes of 99441 through 99443. So again, those are time-based. So you want to make sure that you put your time, how much time you spent, with these patients, especially for some of these time-based codes. It doesn't have to be a start time and a stop time. It can be a total time spent. So you could say I spent 21 minutes with the patient and we discussed, and go through the visit, whatever the discussion was, and then you can utilize that 99443, those 99443 codes. Okay, so that concludes my presentation here. So if you have any additional questions or any questions that you can call me either by telephone or there's an email here for you to be able to answer questions. Any questions that came in today, I am going to take them separately and respond to you via email. So we should have your emails and your information so that I will get back to you with all of the questions that came today. And I thank you all for coming, and I hope that you found this information useful.
Thank you, Suzanne. I want to thank everybody for attending our webinar, and your individual questions will be answered by Suzanne offline. And that concludes our webinar for the day. Thank you, everyone.